everyone. I'm Dr. Pooja Sharma and I'm a practicing gynecologist in Delhi South. My clinic is by the name of Daksh Clinic located at Hostas, and today we are here with myself, Dr. Shelly and Dr. Bandana to talk about something which is very important when we talk about gynecological health. So I welcome you all for this podcast. So we all know a phrase, heavy to happy. How does it sound like? Sounds like the start of yet another weight loss story, right? Maybe a new diet, a fitness transformation, or a morning routine that promises to change your life. But no, this isn't that kind of conversation today. Because today we are not talking about body shape or body size, but we are talking about something that weighs much heavier, and yet it stays hidden in plain sight. We are talking about heavy menstrual bleeding. Yes, it's something that countless women silently deal with every month, but so few actually talk about it. And let's be clear from the start. Heavy menstrual bleeding is anything but normal. Did you know that heavy menstrual bleeding affects up to 38% of women of reproductive age group and accounts for nearly 30% of gynecological visits? Still, most of the women think it's normal to soak pads, miss work, miss school, and feel drained all through the days. Today, we are bursting the biggest myths about heavy periods with the help of our expert guests. I have with me today Dr. Shelly and Dr. Bandana. I would like to introduce Dr. Shelly. Dr. Shelly Singh is a renowned gynecologist practicing in South Delhi. She is Director of Obstetric and Gynecology at Fortis La Femme Hospital, credentiated menopausal practitioner and has been awarded with APJ Abdul Kalam Appreciation Award. Dr. Shelly is her key area of interest lies in high-risk pregnancy care, infertility treatment, and gynecological surgery. We welcome you, Dr. Shelly.
Thank you so much, Dr. Pooja, for having me here.
Thank you, Dr. Shelly. Our second expert is Dr. Bandana Sodhi. Welcome, Dr. Bandana. Dr. Bandana is Director Fortis La Femme, Director Obstetric and Gynecology at Fortis La Femme. Dr. Bandana has special interest in minimal access surgery and has been awarded several times under the field of interest. Her other areas of interest lies in infertility treatment, high-risk pregnancy. She is passionate about teaching, and she is associated with undergraduate and postgraduate teaching courses at MCI, MUHS, and various other institutes. We welcome you, Dr. Bandana.
Thank you so much, Dr. Pooja.
So with Dr. Shelly and Dr. Bandana on our panel, we'll be starting this podcast. We'll be addressing heavy menstrual bleeding and we'll be bursting some myths and facts about the topic. So before we dive into the myths, we'll start with our expert asking them, can you please explain us what heavy menstrual bleeding is? Dr. Shelly, if you can just let us know what is the meaning of heavy menstrual bleeding for a layman when we use this word?
Sure. When we have our periods, it is for a definite length of time and it is also a certain amount of flow which is there. Now, if the periods are happening for more than 7 days, the amount of blood is more than approximately 80 ml, whereas the normal amount of bleeding which happens during one cycle is around 50 ml. In case it increases to about 80 ml, or, for a lay person, in case you're needing to change pads or large tampons every 1 or 2 hours, if you're passing clots, and if it is actually affecting the quality of your life, which means you're anemic, you're feeling tired, weak all the time, if it's affecting your quality of life, that is what is called as heavy menstrual bleeding.
Agree. Thank you, doctor. Thank you so much for sharing that. So now that we know what heavy menstrual bleeding is, Dr. Bandana, we would like you to just share with us what may be the causes from a layman point of view. How can when is the time when the lady feels that this is something abnormal, and what all things should come in her mind when she's having heavy menstrual bleeding?
Thank you, Pooja, for that question. When a patient is having heavy menstrual bleeding, as has already been told by Dr. Shelly, the definition that it should be not more than excess of a normal period. then we should always evaluate as to why she's having this problem. It can be related to so many internal issues, it can be systemic issues. So, when we evaluate the patient, we think of so many things. Our international body has also classified the causes into structural causes and non structural causes. Structural means there can be problems in the uterus. That means things like fibroids, polyps. There are conditions which are adenomyosis. Then there are conditions which can be related to malignancy. So, all these things need to be excluded by us through an ultrasound. She also needs evaluation for the non structural causes. That means coagulopathies, which can be inherited, that is, blood disorders, or it can be because of drug intake, certain medicines if she is taking, and it could be related to her age and hormonal factors if she is in the perimenopausal age group. So, whenever a lady comes to us with a heavy menstrual bleeding, we need to see as to what age group she falls in, and if she's on any medicines, and also order ultrasounds and hormonal evaluations for her.
Agree. So for our audience out here, before we start with myths and facts, what our experts have told us is that if you are having heavy bleeding, if you are soaking your pads very frequently, and your menstrual bleeding on a monthly basis is affecting your quality of life, then certainly it is not normal. Then you need to see a doctor. That is the time when you have to go and meet your doctor. And do not worry, as Dr. Bandana has said, causes can be either related to your structure or it could be non-structural. Means either it can be managed by medicines or it can be managed surgically, but it can be managed. So please, if you are facing any type of heavy bleeding, please seek a medical opinion, go and meet your gynecologist. So there are certain myths and facts that our team has summed up. So I'll be starting with the myths. I'll be asking myths to you, Dr. Shelly and Dr. Bandana, and you can just let us know what is the fact behind those myths. So I'll start with you, Dr. Bandana. So there is a myth that heavy periods are normal periods. Most of the people we have come across, घर में सबको ही बोलते हैं कि bleeding तो होती ही है. It is ना common phrase. दर्द तो होता है और bleeding तो होती ही है. But yes, we all know ये होता है या होती ही है is not normal. So especially we women, elders at home, mothers, grandmothers, they keep saying that it's okay. But is it a myth or is it a fact that heavy periods are normal periods? What do you think about it?
Heavy periods are certainly not normal periods. So it is a myth, right? And as has already been conveyed, it needs evaluation. Blood loss in excess can lead to anemia. It can cause fatigue. It can cause chronic illnesses. It can depress your immune system. So definitely a heavy period is not a normal period.
Thank you. Thank you, Dr. Bandana. With this, I come to the second myth that we have on our list, and it is for you, Dr. Shelly. They say that only older women or teens get heavy bleeding. So it is the extremes of age when a girl or a lady can face heavy bleeding, and in the reproductive age group, heavy bleeding is so-called normal. What do you think about?
No, I don't think that's the case because, as you would know, beginning of one's menstrual periods is the time when the ovarian, the system is being set. So for a few years, maybe 1 or 2 years, there may be hormonal problems before, you hit our normal cycles. So that's the reason why this is common in the very young people. It is also common in people who are in the perimenopause, again, because of the same hormonal reasons. But yes, throughout the reproductive age group, throughout the reproductive life, one can have heavy menstrual bleeding. So it's a myth or a myth, it's to be debunked that it only happens in the extremes of age.
Yes, I totally agree to what you are saying. It is any age group and every age group, whenever you are having heavy menstrual bleeding, it has to be evaluated irrespective of age bracket. Dr. Bandana, the third myth that we have is that so if somebody is having heavy menstrual bleeding, as a practitioner, what would we say? It is better to wait or take treatment immediately. So is there any wait and watch kind of a period, or the lady should go and seek treatment anytime when she feels that no, this is beyond normal. I'm having something which is not normal.
So, we gynecologists are here to help you out. So, if you are having a heavy menstrual period which is not under control and which does not seem like your normal period, please don't keep sitting at home. Please go and see a gynecologist. It could be something which could be unknown to you, but we need to evaluate as to why this is happening. If it appears to be due to hormonal reasons, we treat you. If there is something else which is wrong, like a fibroid or a polyp, we treat you. And my only concern here is that it should not be taken lightly, even if it is a single episode. If there are repeated episodes, definitely it needs to be treated. But even a single episode of an unusual heavy period should be addressed.
Right. Recently, I had a lady in OPD. She was very well educated, middle aged lady in her mid 40s, and she was having heavy bleeding since past 1.5 years. And there was a hitch. She was taking. She was taking oral contraceptive pills. She was taking hormonal combinations. Initially, she took progesterone, and then she was taking combination pill, because of which her bleeding settled. But she was having vaginal discharge continuously. Every month on month, she was having vaginal discharge. And there was a fear that if I go to the doctor, they'll say something and I don't want to undergo a surgery. So this, but over a period of year, I think about after 1.5 years, she visited her doctor, and she was diagnosed with a polyp. It was an endometrial polyp, and simple surgery, and she was absolutely fine in 3 days. But with just the fear of having something bad in the body and not going to doctor and getting herself operated, she kept on bleeding. And when she visited the gynecologist, her hemoglobin was 6.5. So she kept on bleeding. She kept on, very well educated, learned lady. She was taking hormones for past 3-4 months, because of which her bleeding was controlled. But it was discharge eventually that brought her to the doctor. That I'm tired of this discharge, using the liners days on days. So
And
there
here
is there is
we're
a
talking of educated people. And another flip side to this is that Google actually makes people do a lot of things. So well-read women also probably, would have read so much about it, and then
exactly.
and I think every time, even if we were to look at Google for something, I think the next thing we would probably think is we're going to die. So I can imagine
Exactly.
the
She
fear
was so
that she was
scared. She was so scared for a routine consultation that she didn't even visit a doctor.
having.
Yes, so certainly it is not a good idea to wait. As Dr. Bandana has said, even a single episode, by God's grace, in this case, it was a simple polyp, but it could have been something bad also. We all know that in 40s, especially when you are in and around menopause, then yes, it should never be ignored. So with this, I come to you, Dr. Shelly. The next question is, so okay, there is a myth that so heavy bleeding is common only after childbirth, and if you are having it during the postpartum period, then it should be considered normal, and otherwise you should go to the doctor. So heavy menstrual bleeding in postpartum period, we need to know more about this statement. What if a lady is having heavy menstrual bleeding after childbirth? Is it normal? Is it abnormal? Is it a matter of concern?
So, that's also a myth to say that heavy bleeding will happen only after childbirth. Yes, it is. The first few periods which come after childbirth or even after an abortion are a little heavy compared to normal. But then this problem can affect everyone. It may not have anything to do with the pregnancy at all. Like we've just discussed, it can happen in women who are teenagers, it can happen in women who are in the reproductive age group but who are not pregnant, and it can also happen in people who are in the perimenopausal or sometimes even later on in life. So it is actually to be debunked that it will happen only in case of postpartum women.
Yeah, thank you. Thank you. Next question is for you, Dr. Vanna. Heavy menstrual bleeding doesn't cause other health problems. So you can bleed heavily, but as a consequence, you won't face anything bad affecting your general health. Is it a myth, or is it that there is some truth behind it?
It's a big myth. It's but natural to understand that if you're bleeding, what will happen? You lose blood, your hemoglobin falls, your immunity falls, you get tired, and it's all one vicious cycle. So heavy bleeding is not a sign that you're flushing out everything and you're going to be good healthily. You're going to be in a healthy state of affairs, but it'll bring down your hemoglobin drastically. You may need blood transfusions, so it should not. You should not reach that level of a blood loss where you need to be transfused. So definitely not. It's not a good sign at all, and one needs to take care of that. Iron supplements are required. uh, Other medicines which control your bleeding are required so that your general health remains good, your body immunity remains good. So, definitely it's a myth.
Agree, yes. And once you become anemic, you are putting an extra burden on your heart. So there are many organs, if we look at our body from head to toe, that are getting affected by heavy menstrual bleeding. The next question is for you, Dr. Shelly. They say that you just have to live with heavy periods. ऐसा तो होता है. So if you are bleeding heavily, I am blessed that I don't bleed heavily. You are not blessed that you are bleeding heavily. So तुम्हें है तुम झेलो. Two friends, they are sitting together and talking. One says that I have it only for 2 days. I am blessed one, and you bleed for 7 days. It is your problem.
Well, different bodies, different problems. So it's not necessary that my problem will be the same as your problem. But definitely, why do you need to endure this kind of bleeding in this day and age when there are so many things which are available? It's definitely not a good idea to be enduring it. We have many options these days which are available to take care of this bleeding, which means, there are options like non-hormonal medication. We have hormonal medication which is also available. We also have the IUDs which are available, the intrauterine devices, which are some hormone containing ones that are also available. We do have other things like surgeries to take care of any problem that may be there. We have things like endometrial ablation that is there, up to the stage of even a hysterectomy. So there are so many options which are available. And along with that, supportive treatment in the form of, iron supplements, iron transfusion also were required. So there are so many things that are available. Why unnecessarily in this day and age, where there is so much that is available in our basket, why should you be enduring that? That's not a great idea.
Exactly, exactly. So your doctor, your gynecologist can offer you a step ladder pattern. We start from the most conservative treatment and we step up the treatment as and when required as per your body. We aim to give relief to the patient. So please, 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 we all are here to break this myth that please, every bleeding is not dealt with surgery and every bleeding is not normal. Meet your doctor anytime when you face such problem. So the next question is for you, Dr. Banna. Birth control always makes bleeding worse. Is it a myth?
Again, a big myth, big myth. So, birth control pills sometimes the people are really scared of taking birth control pills. They have their own perceptions, they have their own mindset that this will cause side effects, it will cause weight gain, it will cause other problems. But actually, when a patient is put on birth control pills, it will reduce the bleeding for this reason, for heavy menstrual bleeding. It will definitely reduce the flow and it will improve the cyclicity. And it is not a fear that birth control pill is going to cause cancer or other side effects. So definitely it's a big myth and one needs to understand the complications, if there are any, have to be explained to them. And there are contraindications. We don't give it in a certain set of patients. But overall, if we are giving it, then definitely it will help the patient rather than not help the patient. And as Dr. Shelly has already said, it is Google Baba who's sitting there, who's guiding all of us. And we need to definitely de-link ourselves from that, right?
Yes, hormones, the word hormone, the moment you say hormone to a patient,
Yes.
n number of questions. What are the side effects? Especially weight gain. Will I gain weight?
Absolutely, because that seems to be one of the very common questions.
Common concern.
Will I gain weight? But then we have so many new formulations which are available, which in fact, in some of the conditions even help to lose weight. So I think we just need to, as gynecologists, I think all of us need to just reiterate this, that gone are the times when you had those high dose oral pills which were available. We have many options which are now available to tackle different problems.
Exactly. So next question is for you, Dr. Shelly. Heavy periods are normal if they run in the family.
Yeah, so that itself is, there are some conditions which can run in families, definitely, but not all heavy menstrual bleeding happens because of things which are passed on to via the genes. So we do have some things which definitely, like some coagulopathies, etc., which are passed on from the previous generations, but not necessarily all kinds of heavy menstrual bleeding are family related.
Okay. Thank you. Thank you, Dr. Shelly. Thank you, Dr. Vanna. It was an insightful session. Now, with this, I move to the next segment. So now we know what is heavy menstrual bleeding, what are the possible causes. We have talked about certain myths. Now let's talk about the management. Let's move from myths to management. So Dr. Banna, what can a woman actually do if they are dealing with heavy bleeding? If they are dealing with heavy menstrual bleeding during their periods, what is the treatment line which is available?
Okay. The treatment line depends entirely upon the age of the patient, the symptoms she's facing, if on evaluation she has been found to have any underlying cause, if there is any structural cause, any fibroid, any polyps. So the main fear which patients normally have is, especially in a perimenopause age group, is हमारा uterus तो नहीं निकाल दो. So that is the main thing. So as a gynecologist, we need to tell them that we need to evaluate and we need to see why the bleeding is happening. Especially in the perimenopause age group, we need to evaluate any underlying sinister causes like not missing out on any malignancy. So this needs to be explained. So the patient can be treated with medicines, that is hormonal, non-hormonal, and if there is any structural abnormality, which is the cause, a small surgery can be performed. If it's a polyp, it's a small daycare procedure. If it's a fibroid, again, laparoscopically or as we say, keyhole surgery is available to remove that, which reduces the stay of the patient and is cosmetically better, and the outcome is better. And last resort, of course, if she still doesn't respond to medication, then of course hysterectomy is there. In a younger age group, medicines do wonders.
Okay. Thank you, Dr. Banna. Dr. Shelly, you would like to add upon something?
Yeah, so just as Dr. Bandana said, there's one class of patients who feels, that kahin mera uterus to nahi nikal doge. So we need to tell them that, we as gynecologists are very much for preserve the uterus principles, and unless absolutely required, we don't do that. And on the other end, you have patients who will come to you and say, mera uterus to abhi nikal do.
Late 30s also.
Yeah. So that's the reason, where 30, 35-year-olds, they're so scared that they just want ke hame to is jhamele se kuch kaam nahi chahiye, just remove it. So I think that's another subset of people who require to be counseled. And I think that, we have a huge load on our shoulders, and we should actually, all of us should be sort of telling them about the correct way of going forward. As Dr. Bandana said, there's an age, there's an indication for everything, and then we just go forward with so many things which are available in the basket.
Agreed. Yes, and most importantly, what as a doctor, what we want to convey to all of you is that talk openly. Don't feel embarrassed. Don't feel there is no shame that should prevent you from going to your doctor and talking about it openly. Talk to your family, talk to your friend, seek opinion as soon as you can from your doctor. Right? There is no harm. What will happen? Maximum will say that everything is normal. It's okay. Go back home. We'll do a PAPS, we'll do a routine testing, and we'll say that you are fit to go back home. But talking openly to anybody. There are so many forums nowadays. You have peer groups. There are so many options in this era where you can discuss and ultimately prevent yourself from heavy menstrual bleeding and its consequences. So, to all our listeners out here, if your periods are affecting your energy, your confidence, your ability to show up fully in your life, it's time to listen to your body because your periods shouldn't make you suffer. It's a physiological thing. It is as normal as we eat, we breathe. Similarly, menstrual cycle or periods are something very physiological. It should never make you suffer. Right? I thank you, Dr. Shelly and Dr. Bandana, for busting myths and breaking taboos today. It was a lovely session about myths and facts, and hope our listeners enjoyed it too. And to all our listeners over here, if you find this episode helpful, please share it with your friend, sister, daughter, any near and dear one, all ladies and girls in your circle, and let's challenge this stigma. Let's change the story. As we started initially, this is the time that all of us as women, we should realize the importance of, as Dr. Shelly said rightfully, that we should understand in this particular era, this is not time to crib and live with it. This is the time to seek treatment, and this is the era when girls are going for swimming and all the sports with on their menstrual days. So hiding behind and not sharing your problem with others is not the solution. Go ahead, talk, and get yourself treated. Because when it comes to our health, we deserve nothing less than the truth. Let's go ahead and talk. Periods may be natural, but suffering through heavy menstrual bleeding, that's absolutely abnormal. That's anything but normal. So until next time, stay informed, stay empowered. Please take care of yourself. Hope you also enjoyed this podcast as much as we enjoyed talking to you. Thank you so much. Thank you, everyone.
Thank you very much.
Thank you.
Thank you.